Hello, and welcome back. We're having another another scan with Valerie Yamena Bay. You're going to do now a chakra and meridian scan on me. So we've had a nutritional so an energy scan,
yeah, the
inner voice energy scan, and now we're going to try the chakra scan, the meridian scan.
Yes.
So hopefully you're going to find this quite interesting.
Indeed. So let me go ahead and share my screen. So I hope you can see that. Yep, you should be able to see that now. So I am in the vital scan. So if I just come out actually, so you can see where I'm going with this. So I'm going into the vitals. Now, as you can see with the vitals, these are the kind of things I scan for. I can scan for food sensitivities. We've got blood work in here. We've got the chakras, the gastrointestinal function. So we can look at the gut, the meridians. So the chakras and the meridians are what we're going to focus on with Claudia today. And you've also got the physical functionality. That goes more into your arteries, nerves, cardiovascular health, gut, kidneys, you name it, things like that. And then you got the toxicities as well. But I'm going to deselect all those and I'm just going to focus on the meridians and the chakras. And then I'm going to ask Claudia to stick on the bone conductors. Now, what I need you to do is make sure that they sit right in front of your ears at this point here. Okay, so you might want to take your glasses off.
Oh.
All right. So make sure that they sit right here.
Do they lower?
Yeah. So you might have to adjust it to the front of your head.
Oh, I see.
So they just sit here.
Oh, I see. Okay.
Got it? Just make sure it sits. Right. So where we need it is just there.
That one's slightly lower. Okay.
Yeah, that should be it. Okay. All right, so now what I'm going to do, this is going to scan and then I'm going to optimize. So when it comes up on the report, you'll see the before and after. That's exactly what it is. So essentially you're going to have one scan where it's going to scan you as you are now, and then it's going to optimize those frequencies. So we're going to have a look at the report after that. So you ready? Sit there, relax, deep breath. Okay, let's go. So that's how quick it is. So now I'm going to optimize those frequencies for you. There, good, and we are done. So you can remove those now.
Okay, wow, that's interesting.
Yeah. So we're going to look at the enhanced reports again. I'm just going to pause the share for a second and I'm going to email those to you. Yeah. And then I'm going to resume the share again. So as you can see, you've got the color coding here. So if you look at the chart here, you'll see that anything in the green, anything that's green or blue is either mild or normal. Now you've got the number as well from 1 to 9.
Right.
So anything that's on the left-hand side, if it's what we're looking for is 1s or 2s. Okay, on either side. So this shows you that a 1 or a 2 on the diminishing function risk essentially means that it's chronic. Anything 8 or 9, the thing is that with anything here, you would expect it to be, oh, well, it's too much of something, but that actually is not the case. It could also mean it could be an acute deficiency. So that's where it can get quite confusing for some people, because they think, oh, well, say if you're high in B vitamins or something like that, they think, oh, well, maybe I'm just taking too much, which may not be the case. It may be because your body's not absorbing it, for example. All right. So in terms of your chakras, they're all very balanced. So you can see here, can you see here? your heart chakra previous to the optimization was a 1. So what optimization is that it's essentially bringing everything back into balance, which is why now on the current scan, everything's green.
Right.
All right. So what it does, because you can see here you as a 7 and now you're a 5 here. So that's your normal. You see that up there? So what that's done is it's taken probably 2 of those points from there and gave it here. So now that's brought that into balance. Make sense? So essentially what it does is it steals energy from somewhere else. It goes, oh, there's a little bit too much there. Let me put it there because that one's out of whack. So now you're all nice and green. So you look at the heart chakra there. And so it's just, you know about the heart chakras. So you know it's like high blood pressure, breathing difficulties, circulatory problems.
So something to take notice of.
Yes.
Is the heart chakra.
Yeah, because anytime any of your chakras, I mean, you know about how to work with the chakras.
But reading your right. So this is what I need to be aware of.
Yes.
Is the heart chakra.
Yes.
And around that heart chakra to be breathing. Yes, and breathing is something. I have asthma, so that would make sense to me.
Yes.
And then you've got the sacral chakra.
And the sacral chakra, which is an 8. So that's higher.
That makes sense in terms of what I've just been talking to you about sexual abuse. And so that would make absolute sense to me.
Yeah,
that
sexual difficulties. That's
something that continuously need to be overcome.
Yeah.
Up until I started doing goddess chakra dancing, for years I've had collapsed discs, and I would literally collapse, and I have problems with my back. Then I've been doing the work and doing the work and doing the work. It is coming into almost normality. So it's quite interesting that these are the 2 things that I'm continuously aware of and continuously trying to develop.
And it just goes.
But that's pretty good, though. I'm quite pleased.
Yeah.
Somebody works with the chakras. That's not bad. I'm aware of those.
Yeah, exactly. And it just goes to show how accurate this actually is. You see, because it's reading you. Remember, all it's doing is it's reading your body and giving you it real time. So essentially you can go off and continue doing the work or start the work if you've already done so.
Yeah, absolutely.
And that's this is essentially, this is making up for the fact that we are unable to do this ourselves.
Do you often find when people do this, like lit up everywhere, like they've got loads of work to do? Like, is it because I do the work, this is my job, that most of them are normal?
Yeah.
You say, more your experience.
Yes, exactly. Yes, exactly.
Like,
because,
I'm doing
exactly. Mine tend to be all green as well because I do a lot of yoga.
Yeah.
So I work a lot on the chakras that are pertinent to me that come up.
Yeah.
My one, I think was it the heart or the solar plexus maybe, because I had issues with my blood sugar, and so you've got diabetes and hypoglycemia, so that tends to come up for me.
So what we've got here is you've got a 1 on the heart chakra.
Yes.
So is 1. So is that so in terms of?
It tends to be chronic.
Okay, so it's chronic is on that. Okay.
Yes.
And then the 8 is I'm doing all right. I got a bit more work.
Yeah, you got a bit more work, but remember the 8 could either signify that it's acute, it's something that's come up recently that needs to be dealt with, or it could be meaning that it's also a deficiency, an acute deficiency. So essentially, something that's acute is not sudden onset, but it could be a more recent thing. So essentially, it's something to keep an eye on. So if you were to have this again, then you could see, say if you were to do this every week, you would be able to see. Yeah,
I have to keep an eye on the prolapse wound situation. And so that's something. And but it's interesting around, so the heart chakra also covers the lungs, right?
Because you can always look at what the heart chakra
is. Can you read that?
The sacral. Oh, you can put your glasses back on.
I have got my glasses.
Oh, right, okay.
What does it say on the throat?
The sacral.
Not the throat.
The heart chakra.
Interestingly, it's blue. Why is it blue?
Because remember, if we're going back to all these as well.
Oh, okay. So it's not that colour doesn't correlate to the.
Oh no, remember, no.
Oh no. Okay,
so you're just looking at the chart here. Sorry,
okay,
it's the low. and then you've got high here. So this is like high, normal, low. So this is just the heart chakra, is just a bit, say, depressed, if you like.
Yes, yes.
So that's what we're looking at.
So what does it say on there on the chart?
So the high, so for the heart chakra, you're looking at high blood pressure, breathing difficulties, circulation problems, shortness of breath, chest pains, disorders of the heart, tension between the shoulders.
Yeah, it's to do with my lungs.
Okay. And then the sacral one, you're looking at uterine or bladder problems, sexual difficulties, impotence, lack of flexibility, sciatica, lower back problems. With the large intestines. Well, great. I'm at 8, so it's fine. I've got a little bit way to go, but that's definitely on the mend. So that makes a lot of sense. Yeah. Yeah. Okay. Good. Great stuff. And then you've got your meridians now. So you can see here with the large intestines, previously you were a 2, small intestines, you're at a 2. So you've got some work to do there. So that's quite low at the moment. So if we were to, and then then you've got the pericardium, meridian. Previous you were a 1, but the triple warmer, you're 9. So if we go down to the triple warmer, here we go. That's the endocrine system, hormonal imbalance, the autonomic nervous system, basic drives of the appetite, metabolic rate. So that's the heat. Yeah, makes sense because we've just gone into menopause. Yes. And it affects the thermostat in the brain. The 3 burning spaces are the chest, respiratory, abdomen, digestive, pelvis, reproductive, and elimination. Makes total sense. Yeah. Makes total sense. And that just ties in with what they just said about the chakras as well. Yeah. Respiratory and the sacral chakra. Yes. Yeah, absolutely. And then you've got the emotional links to that, which is hope and hopelessness, depression and despair, loneliness and isolation, issues with family and social dynamics, impatience. The family dynamics makes sense. I am actually working through a lot of work with that. Yeah. Excellent. Yeah, so that's your triple warmer. So you've got a 9 there. So if we just scroll back up quickly. But interesting, the 9 is it's high, meaning that it's not critical, it's not chronic. It's high, as in there's a lot of work to do. Oh, there is a lot of work to do. And so the low is less work. Yeah. So it's showing. So when something's low, normally what that means, say what small intestines, we'll have a look at that. That's low, meaning that remember, you're just looking at to bring everything back into balance. So if something's low, it just needs to be brought back up. If something high, it needs to be brought back down. So all those with your triple warmer, because it's right now, it's something you're working towards and it's all up, maybe scattered all up in the air at the moment. It just needs to work on it, and eventually, as you work on it, you'll find that those numbers decrease. So that's it. So it's a chronic one. It's the red ones I'm looking at, right? Yes. Yeah. So if we look at the small intestines now, if we just scroll down to the small intestine meridian, which is here. So the physical links, we're looking at the small intestine, intestinal flora, food allergies, mucous membranes of the intestines, nose and throat, sinuses, ear infections, pain or tinnitus, or nervous disease. Okay, so I've always suffered with rhinitis. So I've always had issues around rhinitis, and mucus has been an issue, and that's been very much in connection with the respiratory issue. Yeah, you can hear it as well. Yeah. And so with the small intestine, the emotional links, you're looking at digesting life, dealing with emotional and mental demands, insecurity, sadness, or lack of joy. Okay. All right. So those are the ones that are more pertinent to you. The rest are all pretty balanced. If we look at the pericardium here, even though it's balanced now, we'll have a look at that as well. because it's always interesting to know and to keep that. So the pericardium is your circulation, sex, the king's bodyguard. So the physical, you're looking at the protective fibrous sac around the heart. So we're looking at blood pressure, blood circulation, chest pain and pressure, spasms, libido, sexual energy, heart shield, physical and emotional. So that's the heart shield.
Interesting again how it equates the sacral and the heart chakra together. It's going back to the same thing, sex and respiratory, and the sort of the two things to keep an eye on these two areas.
Yeah,
it's very, very much saying that in both the chakras and in the meridians, isn't it?
Yeah, absolutely. Yeah. So, and your emotional links to the pericardium is seeing life as pressure, poorly shielded from your own or others' negative emotions like hurt, regret, and jealousy, also sexual tension. All making sense now?
Yes, in a way. Yeah, no, it does. It's interesting because yeah, it does make sense to me. It does make sense to me, but I think that that's all something that's being worked on, and it's something that's really coming up. And funny, because I just put a post out there yesterday about the doing the goddess chakra dancing. It's like we're working on the tantric elements, we're working on the sexual elements, and when you go into menopause, your sex drive is completely different. It completely can diminish. But I have felt like that's really coming back out for me. But it's work. It's work. You have to do work on it. You can't just imagine that you're just going to feel sexually active like you used to when you're in your 20s or 30s or in your 40s. When you get to your 50s, you don't have those same feelings that are going on there because the hormones aren't happening down there. So you actually have to put your mind to it and make the effort. So tantric work is really important in raising that sexual energy. So
yeah,
it's
absolutely.
really interesting that's being pointed out.
Yeah, absolutely. Yeah, I mean, I just love this for what it can point out for women who feel that there's a disconnect, but they don't necessarily know what it is or how to address it. Something like this is going to help them do that. So if you were to do something like this, it's going to pinpoint for you. It's going to make that your work even. Yeah,
no, absolutely. I mean, it's funny because last night I was talking about it, and I'm actually been sort of considering doing a tantric and becoming a tantric practitioner on top of the work I already do. And for somebody who had a very high, I don't mind sharing with my goodness, I had a very high sex drive, and I don't have that side. I have to actually do the work now in order to bring it in and call it in and note that I need it.
Yeah.
You know what I mean? I have to make an effort into needing it and wanting it, and understanding that if we don't do that, then we can shut down so much around our creativity. So it's definitely calling out. I know there's a lot of younger women on this course as well, but to the older ladies in the group, older menopausal ladies, that we do have to keep noting that we need to keep, we need to get that going. It's interesting that that's the area that you work in, specialize in, excuse me, is the sacral energy, is the energy of the reproductive energy. So both with women who are trying to maybe get pregnant and women who maybe have been past that age. Now, what do they do to keep themselves nutritionally balanced and in the right place? So absolutely, yeah, then you're the person to speak to. It's amazing, absolutely fascinating. I'm very happy to share this. So thank you once again.
You're welcome,
Valerie. I'll be sending out all your details with this and the other videos. So thank you very much.
No problem at all.
Thank you so much.
You're welcome.
For your time today.
Okay. Bye all.
Bye-bye.